Hello, Dr. James Bogash, publisher of Modern Health Mess. Today we're going to talk briefly about COVID, but in particular some things that play a big role in bad outcomes, which is something that we seem to be avoiding the conversation on in today's day and age. We talk about all the conversation is taken up by things like masks, which may or may not help. In the meantime, we're not having discussions about things that will absolutely help, and there is very little disagreement on. So it's just been strange times that the things we know we need to talk about, people are avoiding. I call it the pink elephant in the room with a tutu and ballet slippers on. So we kind of dance around this topic without actually addressing it. So in this particular study, the author is suggesting that the combination of vitamin D and air pollution becomes an incredibly toxic combination with COVID-19. One of the reasons is because vitamin D, one of those no-brainers in a scenario like this, because not only does vitamin D help us fight off an infection, but it also helps control the immune system from overdoing what it's supposed to be doing once we have an infection. So at a variety of points along the pathway, vitamin D plays a critical role. Despite this, sunlight exposure and taking vitamin D supplementation is not anything I've heard from any higher up authority. Instead, it's about washing your hands, keep your distance, and wear a mask instead of supporting your own immune system to do what it's supposed to do, which is fight off weird, strange viruses that your body has never seen before. So the technical part of this is that vitamin D produces a antimicrobial protein, and this particular protein helps us fight off things like viruses. The problem is when air pollution is present, it interferes with this process. And so you have the combination of air pollution, which can also reduce the ultraviolet light, making it down to the surface and helping us generate vitamin D. But that combination is a perfect storm for the immune system as it relates to COVID. This ties in very nicely with studies we've seen about air pollution playing a role in Italy in the number of cases, areas that had higher levels of air pollution, typically measured as parts per million, particulate matter, PM, and areas in Italy that had higher levels of PM had higher number of cases of COVID. And in the United States, we've seen studies where higher levels of particulate matter, again, as measured in PM, had higher levels of death. You combine that with the vitamin D studies, and this makes absolute sense, and it's something that nobody is talking about. So as a very base, I think, of course, if you live in a polluted area, it's not like you can pick up and move, but vitamin D is something that's very easy, very inexpensive, and very safe to take. I generally, in times like this, I've recommended upwards of 6,000 a day, which is how much I take on top of what I call rational sun exposure. And I have no concerns at all about my levels being too high. I generally don't even check them because the safety window of vitamin D in the bloodstream is very high. So as always, please give a like to this channel, share it with somebody you think needs to hear this message, and subscribe to the channel.